Welcome to Heart Health for Men Over 40, the first episode in our vital 4-part series dedicated to empowering you with crucial knowledge. Today, we'll demystify two often confused heart conditions, heart attack and cardiac arrest, understanding their differences and recognizing their warning signs. A heart attack occurs when a blocked artery prevents oxygen-rich blood from reaching a section of the heart, often due to a blood clot on plaque buildup. If this blockage isn't cleared quickly, the affected heart muscle begins to die, leading to greater damage the longer it persists. In contrast, cardiac arrest is an electrical problem where the heart suddenly stops beating due to erratic electrical impulses. This irregular heartbeat, or arrhythmia, prevents the heart from pumping blood to vital organs, causing immediate loss of consciousness and no pulse. Without immediate treatment, cardiac arrest can be fatal within minutes, highlighting the urgency of recognition and response. While distinct, heart attacks and cardiac arrest are related. A heart attack can significantly increase the risk of cardiac arrest. Damage to the heart muscle during a heart attack can disrupt the heart's electrical system, potentially triggering an arrhythmia. Recognizing heart attack symptoms is crucial for timely intervention. Common signs include chest pain or discomfort, feeling like pressure or tightness. This discomfort can last for more than a few minutes or come and go, often radiating to the arms, shoulder, back, neck, jaw, or stomach. Shortness of breath, cold sweat, nausea, lightheadedness, or sudden dizziness can also accompany chest discomfort. It's important to remember that heart attack symptoms can vary, with some individuals experiencing mild or even no symptoms, known as a silent heart attack. Cardiac arrest often occurs suddenly and without warning, with primary signs including sudden collapse, no pulse, and no breathing. Sometimes, symptoms like chest discomfort or palpitations may precede cardiac arrest, but it can also strike with no prior indications. Several risk factors increase the likelihood of heart attack and cardiac arrest in men over 40, including age and a family history of early heart disease. Smoking significantly elevates risk, as do uncontrolled high blood pressure and high levels of LDL, or bad cholesterol. Obesity, diabetes, and a lack of physical activity are also major contributors to heart disease risk. An unhealthy diet, excessive alcohol consumption, chronic stress, and sleep apnea further increase your vulnerability. Adopting a heart-healthy lifestyle is essential for prevention. This includes regular exercise, aiming for at least 30 minutes most days. Eat a diet rich in fruits, vegetables, whole grains, and lean protein, while limiting saturated and trans fats, sodium, and added sugars. Maintaining a healthy weight, quitting smoking, and finding healthy ways to manage stress are also crucial steps. Regular checkups with your doctor are vital, especially if you have risk factors, and always know your blood pressure, cholesterol, and blood sugar levels. If you suspect someone is having a heart attack, call 911 immediately. Time is muscle, and every second counts. If the person is unconscious and not breathing, begin hands-only CPR if you're not trained in full CPR. For suspected cardiac arrest, call 911 immediately, begin CPR, and use an automated external defibrillator, or AED, if one is available. Understanding these differences and knowing how to respond can save lives, including your own or someone you care about. In our next episode, we will delve deeper into the diagnostic tests used to assess heart health and explore the various treatment options available. Stay tuned to learn more about how to protect your heart and live a long, healthy life. Thank you for watching.
Welcome back to our series on heart health for men over 40. In our last episode, we distinguished between a heart attack, a plumbing problem, and cardiac arrest, an electrical issue. Today, we delve into the critical risk factors that significantly impact heart health, especially for men over 40, where heart disease is a leading cause of death. While some risks are unavoidable, many can be managed through lifestyle changes and medical care, empowering you to take control of your heart health. Let's start with diet. Unhealthy eating, rich in saturated and trans fats, cholesterol, sodium, and added sugars, contributes to atherosclerosis. This plaque buildup narrows arteries, increasing your risk. A heart-healthy diet, full of fruits, vegetables, whole grains, lean proteins, and omega-3s, is crucial. Next, regular physical activity is vital. Aim for at least 150 minutes of moderate-intensity exercise weekly. Exercise lowers blood pressure, reduces cholesterol, and helps maintain a healthy weight, all critical for heart health. Smoking is another major risk factor. It severely damages your heart and blood vessels, accelerating atherosclerosis. Nicotine raises blood pressure, and carbon monoxide reduces oxygen in your blood. Quitting smoking is one of the most impactful steps you can take. Excessive alcohol consumption can also harm your heart by raising blood pressure and triglyceride levels. Men should limit alcohol intake to no more than 2 drinks per day to protect their cardiovascular system. Being overweight or obese significantly increases your risk of heart disease, high blood pressure, high cholesterol, and diabetes. Maintaining a healthy weight through balanced diet and regular exercise is crucial for long-term heart health. Chronic stress also negatively impacts your heart. Techniques like meditation, deep breathing, and spending time with loved ones can help. If stress becomes overwhelming, seeking professional counseling is a valuable option for managing its effects. Now, let's discuss genetic predisposition. A family history of early heart attacks before age 55 for males significantly increases your risk. Genetic factors can influence conditions like high blood pressure and heart disease, with some men inheriting a higher risk from their fathers. While not yet standard, genetic testing for cardiovascular diseases may become a more common tool in the future for personalized risk assessment. Beyond lifestyle and genetics, several medical conditions also elevate your heart attack risk. High blood pressure or hypertension damages arteries over time, making them more susceptible to heart attacks and strokes. High LDL or bad cholesterol narrows arteries, while low HDL, good cholesterol, increases heart attack risk. Diabetes, characterized by high blood sugar, also significantly raises the risk of both heart attack and stroke. Metabolic syndrome, a cluster of conditions including an enlarged waist, high blood pressure, and high blood sugar, doubles your heart disease risk. Other conditions like chronic kidney disease, inflammatory conditions, and even sleep apnea can also increase heart attack risk. Interestingly, erectile dysfunction can sometimes be an early indicator of underlying cardiovascular issues. Understanding these risk factors is the first step. It's crucial to work with your healthcare provider to manage them effectively. Regular checkups, including screenings for blood pressure, cholesterol, and blood sugar, are essential for early detection and management. Embrace healthy lifestyle choices, a balanced diet, consistent exercise, quitting smoking, limiting alcohol, and managing stress. If prescribed, take medications as directed to control conditions like high blood pressure, high cholesterol, or diabetes. In Episode 3, we'll cover recognizing the signs and symptoms of a heart attack and cardiac arrest, and what immediate actions to take in an emergency. Stay informed and proactive in protecting your heart health. Your well-being is in your hands.
40. In this third episode, we'll explore proactive prevention strategies and positive lifestyle changes. Adopting these strategies can significantly reduce your risk of heart attack and cardiac arrest, empowering you to take control of your heart health. Let's begin with one of the most impactful changes, a heart-healthy diet. It's about nourishing your body with the right foods. Emphasize fruits, vegetables, and whole grains in your daily meals. These are packed with essential nutrients and fiber. Include lean proteins like fish, poultry, beans, and nuts, while limiting saturated and trans fats found in red meat and processed foods. Reduce sodium intake by avoiding processed foods and limiting added salt, and increase fiber with oats and legumes. Next, regular exercise is crucial. Aim for at least 150 minutes of moderate intensity activity each week. This can include aerobic exercises like brisk walking, cycling, or swimming, which are excellent for cardiovascular health. Don't forget to incorporate resistance training using weights, resistance bands, or bodyweight exercises to build strength. Even short bursts of activity throughout the day can contribute significantly to your overall fitness and heart health. Stress management is another vital component. Chronic stress can negatively impact your heart. Practice mindfulness and meditation techniques, or engage in deep breathing and relaxation exercises to calm your mind. Pursue hobbies, connect with friends and family, and manage your time effectively to reduce daily pressures. Quitting smoking is perhaps the single most effective way to improve your heart health, with benefits seen almost immediately. Within 24 hours of quitting, your risk of heart attack begins to decline and blood pressure starts to normalize. Resources like nicotine replacement therapy, medication, and support groups can provide invaluable aid in your journey to quit. Maintaining a healthy weight through a balanced diet and regular exercise is also crucial for heart health. Even a small amount of weight loss can significantly improve heart health and reduce the risk of related conditions. Regular health checkups are essential. Consult your healthcare provider to monitor cholesterol and blood pressure levels. Discuss any existing conditions like diabetes or obesity with your doctor and ask about preventive measures. Prioritize 7 to 9 hours of uninterrupted sleep per night. Establish a regular sleep schedule and a relaxing bedtime routine. Finally, limit alcohol consumption. If you drink, do so in moderation, no more than 2 drinks per day for men. Excessive alcohol can raise blood pressure and contribute to heart problems, so moderation is key. By implementing these strategies, men over 40 can take proactive steps to protect their heart health and reduce their risk. These lifestyle changes are not just about prevention, they're about enhancing your overall quality of life. Join us in the final episode, where we will discuss emergency response for heart attack and cardiac arrest,
where we focus on critical emergency response. Understanding the immediate steps to take during a heart attack or cardiac arrest can be the difference between life and death. It's crucial to distinguish between a heart attack and cardiac arrest, as their causes and immediate responses differ significantly. A heart attack is a circulation problem, occurring when a blocked artery prevents blood flow to the heart muscle, causing tissue damage. Cardiac arrest, however, is an electrical problem where the heart suddenly stops beating effectively, leading to a loss of consciousness. While distinct, a severe heart attack can sometimes trigger cardiac arrest, making early recognition vital for both conditions. For men over 40, recognizing heart attack symptoms is paramount. Look for chest discomfort, often described as pressure, tightness, or squeezing. This pain can radiate to the upper body, including the arms, back, neck, jaw, or stomach, and may be accompanied by shortness of breath. Other signs include cold sweats, nausea, dizziness, a rapid heartbeat, unusual fatigue, and a profound feeling of impending doom. If you suspect a heart attack, the very first step is to call 911 or your local emergency number immediately. Help the person rest in a comfortable position, ideally sitting up, and loosen any tight clothing around their neck or chest. If they have prescribed chest pain medication, such as nitroglycerin, assist them in taking it as directed. Administering aspirin, if recommended by emergency services and not contraindicated, can also be beneficial by helping to prevent blood clots. Now, let's turn our attention to cardiac arrest, which presents with more dramatic and immediate symptoms. The primary signs of cardiac arrest are sudden collapse, unresponsiveness, and no normal breathing, often appearing as gasping. Crucially, there will be no pulse. While some may experience prior warning signs, the onset is typically abrupt. For suspected cardiac arrest, immediate action is paramount. First, call 911 or your emergency number without delay. Next, begin cardiopulmonary resuscitation or CPR if you are trained. Push hard and fast in the center of the chest. Aim for 100 to 120 compressions per minute, allowing the chest to fully recoil between each push. If trained, incorporate rescue breaths after every 30 compressions. If not, hands-only CPR is a viable and effective alternative. If an automated external defibrillator, or AD, is available, use it immediately. Follow its clear audio prompts. The chain of survival outlines the critical steps to maximize the chances of survival from cardiac arrest. It begins with early recognition of cardiac arrest and immediate activation of emergency services by calling 911. This is followed by early CPR, which maintains blood flow to vital organs until professional help arrives. Rapid defibrillation with an AD is the next crucial step, as it can restart the heart's electrical activity. Advanced resuscitation by emergency medical services, or EMS, provides further medical intervention. Post-cardiac arrest care and recovery efforts then focus on long-term healing and rehabilitation. Staying updated with CPR guidelines from organizations like the American Heart Association and American Red Cross is highly recommended. These organizations provide valuable resources and training to ensure you are prepared to act confidently in an emergency. Knowing these emergency response steps can empower you to save a life, whether it's a loved one, a friend, or a stranger. Thank you for joining us in this series on heart health. Your knowledge and readiness can make all the difference.